Mati, we can start the recording of the session. Okay. So this is, I understand, but you can all see my screen in presentation mode because
yes,
when it is this way, I cannot see any of you. Okay. Well, good morning, everybody. Welcome to this second open market consultation launched by the Procure for Health community on the topic of sustainable personal protection against pathogens in the health and care context. My name is Carlos Larrañeta. I work for the Andalusian Public Health System, and I'm the coordinator of the Procure for Health community. Before we start, some housekeeping rules. Our section will be recorded and uploaded in our webpage afterwards. The list of participants will not be disseminated, so if you wish total privacy, please turn off your camera. Presentations will be shared with the participants. And regarding the Q&A session, please do type your questions in the chat. We will address as many as possible during the discussion slot we have in the agenda. But anyhow, a Q&A document will be published afterwards containing the questions we assessed and those that we do not have time, if we do not have the time. Okay, so the agenda for today's open market consultation. I will do some initial contextualization. Who is Procure for Health? What is our objectives? How have we reached to this point? After me, Beatriz Gomez from Corbers will introduce the basis of an open market consultation within the procurement of innovation process. How does it work? Followed by Ali Faki from Healthcare Without Harm, who is the leader of a sustainability working group within Procure for Health. He will introduce today's use case. Then Karsten Lenken from Zenit will present the results or our findings from the market analysis. Egli Rokia from Corbers will present our findings from the state-of-the-art analysis. And finally, we will have some room to solve any doubts you may have. Okay. So, as I said, this is an open market consultation launched by the Procure for Health community. So I have to introduce us for those of you that do not know us. We are a group of health and care services providers who has the mandate to improve health and care system. Improving or optimizing health systems is a polyhedric issue. We are the ones that have to face it or have the mandate to do so by adopting innovations that tackle the challenges we face. In this slide, you can see the founding members of Procure for Health, 19 procurers from all over Europe, and a number of the most experienced, capacitated organizations in procurement of innovation across Europe. So we represent the demand of innovative solutions in the health sector. Nowadays, we're over 170 members in our community, and we have, of those members, 70 of them are procurers or health and care services providers. So what we are presenting today is a challenge that has a relevant consensus among the healthcare systems in Europe. Procurement of innovation. We are going to be hearing a lot about procurement of innovation. So some of you may already be familiarized with the instrument, some of you may not. So I will briefly explain the basis of procurement of innovation. As I said, our goal is to uptake innovations, but for us, to uptake an innovation is to procure an innovation. But instead of going to procure something off the shelf that might only fit partially our needs, what we're doing is telling the innovation ecosystem, the market players, this is our need, our challenge. If you find a solution, we will procure it, but we'll go one step further. and say, if we like the solution you propose, we will not only procure the final product, but also the final stages of its development. Very briefly, the procurement of innovations journey. It is a process, it's an instrument that makes sense. We can say there is an initial phase, a phase one, that it belongs, is internal to the health and care services providers, to the procurers, which is to assess, define, evaluate, and prioritize the needs or challenges we have. Second phase is looking at the innovation ecosystem around and ask, is there already a solution in the market? Does it really fit our needs? To what end? If not, is it feasible to develop a solution? What will require time-wise, money-wise? With that information, we prepare and we have to launch a tender, a contract, and develop the solutions, the project. That will be the phase 3 of the procurement of innovation journey. If we are successful in all this, final stage will be the actual escalation and deployment of the solutions in our organizations. This open market consultation is the end of phase 2. As I said, what we are presenting today is a challenge that has a relevant consensus and endorsement among healthcare services providers across Europe. It has arisen from the activities of the people health community. So, what can you expect from now on? Well, with the information we gather, we have to build, or we will build a tender, a contract that is feasible and realistic. Typically, the procurement of innovation process, in the procurement of innovation process or journey, we will launch a competition among all the solutions we foresee that have the potential to have a positive impact. In this slide, you can see the usual phases in which this development process is divided. At the end of each of the phases, we evaluate the progress and we continue supporting those solutions that show more potential to have an impact. So, just as a final remark for those that have or approach initially the procurement of innovation instrument, what we're talking about here is tenders, contracts, not grants. I have been most of my professional life in the supply of the innovation solutions side, and I can really say that I would rather have a contract than a grant. So this is a very interesting instrument. So this is it from my side as an institution. Now I leave the floor to Beatriz.
Well, thank you very much, Carlos, for this fantastic explanation. I'm going to share my screen with you. Can you see it in presenter mode?
Yes.
Fantastic, thank you. Welcome everybody. My name is Beatriz Gomez, as Carlos already mentioned, and I'm working for Corbes Procurement Services. So in these slides, I would like to complement the information that Carlos already mentioned and give you an idea about the pre-commercial procurement, which is the procurement that we aim to implement in the future, and also about what is an open market consultation, why we are organizing this event, and what we expect from you also during this process. First of all, a little explanation about pre-commercial procurement. It was already mentioned what is innovation procurement, and also the situation in which there is a need that cannot be covered with the solutions that are usually available in the market, that requires a certain degree of innovation. And within innovation procurement, we have typically two approaches or two modalities. One is a pre-commercial procurement, which is oriented to buy research and development services. I will give you some more details in a minute. But we also have another, which is the public procurement of innovative solutions, in which, well, we buy a solution that is innovative, that is close to the market or already in the market, but not in an extended way, and we still need to adapt to our needs. So in both cases, we are buying innovation, but in a different way. So coming back to pre-commercial procurement, as I mentioned, basically the public buyers use this instrument when they need to satisfy a need. They need a solution, but after doing the research that they are doing about the market, about the technologies that are available, as we did in this project, they realize that, well, the solutions available in the market are not suitable. So there are no solution that can satisfy my needs, and there is not going to be that solution in the short term or mid-term. So if we want as public buyers to satisfy that need, we need to develop it ourselves, of course, in collaboration with the private sector. So as you can see here in the left side of the screen, you see let's say a scale with different colors. We basically use pre-commercial procurement when the technological level of maturity of the solutions is quite low. So it's between a TRL, technical readiness level, 3 and 8. So we still need to invest in developing the solution, in making that solution more mature in order to become a final product that we can use. What is interesting about this approach is that pre-commercial procurement is a competitive development in phase. So it's basically a procedure that is composed of several phases that you can see here in the right part of the slide. Usually a first phase in which we ask the contractor to design a solution, let's say on paper. Then a second phase in which that contractor is going to be focusing on developing a prototype and testing that prototype, let's say in a controlled environment. And then we have also a third phase in which that prototype, that solution, is going to be testing an operational environment, in order to see if in practice that solution really satisfies the needs that we have. So it's interesting to know that it has several phases, but also it has several contractors. So usually in a traditional procurement, you have one contract and you have one contractor. But in this case, because we are buying innovation, and of course, it also implies a certain degree of uncertainty, we want that several contractors develop the solutions at the same time, in parallel. That's interesting because, of course, it's a way to minimize the risk for the contracting authority, but also ensure that there is competition during all the procedure. And that means we are getting a better solution, but also a better price, because from the very beginning to the end, we have this competitive approach. Also interesting to mention that in the case of pre-commercial procurement, there is a risk and benefit sharing between the parties, so between the contracting authority and the contractor. And a clear example is the intellectual property rights. As a general rule, of course, the contracting authority pays the contract, but the contractor who developed the solution will have the right to keep the intellectual property rights that it generates during the PCP. Of course, in exchange, the contracting authority will also have the opportunity or the right to keep a license to use the solution free of charge and in an indefinitely. And also important to say, in this case, in the future PCP that we are trying to implement, we only are going to buy research and development services. So we are not going to buy the final solution because that will be out of the scope of this procedure. If we would like in the future to buy the solution, we will have to initiate a new procedure. Well, that was a little, or let's say a brief explanation about the procedure that we aim to prepare for the future. Here you can see the preparatory steps. So basically during the project, we have first identified the need. As Carlos mentioned, we have a working group which is focused on sustainability. And within the conversations and discussions of the public buyers in this working group, we have identified this need. And of course, we have performed a state-of-the-art analysis, and a market consultation. So, a market analysis. So we went to the market to see which solutions are already available, if there are standards, if there are patents, with the idea to see which is the maturity of the technology. And now we are here, as you can see, in the open market consultation. So the next step, when we have a clear need, when we have a check what is out there in the market, we want to cross-check it with you, with the technology providers. No, we want to get your feedback to understand, first of all, if our findings are complete, they are accurate, but also if you are aware of any other solution that is in the market, and inform you that, well, in the future, we plan to launch this PCP and that this need will have to be covered. And if you are ready and willing to do it, well, that will be great. So this is the stage which we are. And that's also not the importance I mentioned a little bit about the open market consultation, is to engage with the market as much as possible in order to work together to create the solution. So what are the objectives of this OMC? First of all, as I said before, is validate the findings of our homework, let's say, of our state-of-the-art analysis, our market analysis. And of course, also, we want the feedback about more specific aspects, no, about the technical and financial provisions that we aim to include in the future tender, about the functionalities that we are including in this use case, if we are missing something, if you understand that new functionalities are needed, but also about the timeline, no? How much time we will need for developing this solution, how much time per phase, also, in your opinion, which is the budget that we need, no? All of these aspects, of course, need to be validated with the market. Also, as I also said, raise awareness of the industry and relevant stakeholders. So if you are working already in this field and you think that this may be interesting for you, it's a way also to know well in advance that we are planning to launch this tender and well, get prepared within your possibilities, of course, and assess if you have the capability to cover this challenge. And yeah, collect insights from the industry to fine-tune the tender specifications. With this is key because, of course, by including the providers, by including you in this conversation, we also want to fine-tune the tender specifications to ensure that the tenders that we launch will be suitable and the market will be in conditions to cover, to comply with them and cover the challenge. Well, within this OMC, we have several activities. So first of all, we publish a prior information notice to already inform the market about the launching of this open market consultation. We also publish an OMC document, which is available in the Procure for Health website. This document is very comprehensive, and here you can see all the information regarding the challenge, the use case, the public buyers, also a little bit about what is a PCP and the rules of the OMC. So all the information you want to know about the use case and the OMC is going to be there. And we have also published a EU survey questionnaire. So with this questionnaire, what we want is what I mentioned already before, no? To get your opinion, to get your feedback, to validate our findings. So we really encourage you to please help us in this process. So here you can see you have a QR code. Also, you have the link to the survey in the project website and in the OMC document, so easy to access. It's a short questionnaire, it's not very long, so we will really appreciate if you take the time to just give us your feedback and provide your knowledge concerning this use case, because it will be really, really helpful and really valuable for us. We also have, apart from this OMC event in which you are attending today, and of course, our idea is after all these activities, we will prepare an open market consultation report, and we will publish it in the website, in which we will provide information about all the feedback we receive from the market and about all the relevant aspects that we gather during the PCP. Of course, all the information will be anonymized, so do not worry because your answers are fully confidential. So it's not going to happen that the report say this company provide this information. So you can be confident that we will protect the information that you provide. And then the idea is that by the end of May, we will close the OMC. Well, so that was all from my side. Again, I would like to highlight that your feedback is essential. So please fill in the questionnaire. And if you have any doubts, happy to address at the end of the session. Thank you. And I think I give the floor to my colleagues now.
I think it's Ali now, right?
Yes. Right. Good morning, everyone. Let me just share my screen. Is it shared on full screen mode?
Yes, Ali.
All right, perfect. So my name is Ali Faqih, and I work with Healthcare Without Harm Europe. We're partners in the Procure for Health project, but we're also leading on the sustainability working group within this project. And we address this need as a common need. So I will jump in the next 10 minutes to explain briefly to contextualize and explain briefly what is this need. So we're looking for a sustainable personal protection against pathogens in the healthcare context, or as different way to put it is an alternative to single-use face masks with better environmental, economical, and social impact. Since the main problem that has been identified is that the single-use face masks in the healthcare setting, especially after the COVID period, has brought to light a pressing concern that they lack sustainability across various dimensions, but also beyond their need and essential use to prevent and combat infectious diseases. They symbolize a challenge. These are on economic, on the social, and the environmental. And these complexities are not just by the waste is generated when we discard those masks, but even during their production, but also some questions about their sustainability in the logistical form on where we import them, and what is the environmental impact and social impact on importing those masks. So it had become clear that we should reevaluate and we should examine to strategically have a replacement to those single-use face masks. The scope of the problem. So we have an environmental, social, and economic, as I explained, and the single-use face masks contribute to environmental pollution and waste due to their non-biodegradable materials, but also the improper disposal, and usually masks are highly infectious, and these diseases could spread into the environment and return back to the human and the public. They are also resource intensive when manufacturing, and for that we're looking for a sustainable alternative to protect the environment. They're high in demand, so we always have to keep producing, while being high in demand means they are resource consumption and the need of constant production. This will lead to environmental concern both on the production and the disposal. As the disposal is also a concern, then we have a waste management challenge. Regarding the social aspect, usually the masks we're using are imported from countries outside the EU, and where there's lack of monitoring on the labor laws on those countries, and this could perpetuate exploitative working conditions. The last one is the economic challenge and concern.
Dziękuję bardzo, do zobaczenia jutro w takim razie.
Sorry, Mike, I'm muted. Okay, so for the economic part is that usually we depend too much in the EU to import those face masks, which leave us vulnerable and undermines the local production and capacities within the EU. So with high dependency, with the crisis, this will keep us dependent on importing masks from outside. The situation now is that there is a high demand and use of face masks to prevent the spread of the viruses in public health facilities. However, the predominant use of disposable face masks leads to significant waste generation and environmental concern, along with other concerns I just mentioned. What is the wish situation and how do we wish to see it is that we need an alternative to single-use face masks that offer the same protection capabilities, and it should be disposed with a sustainability reduced environment impact throughout its life cycle. and this alternative should be manufacturable within the EU, and its price is competitive compared to the existing single-use face masks. The use case is implementation of a sustainable and effective pathogen protective system in the healthcare context that can replace the single-use face mask and significantly contribute to waste reduction, environmental sustainability, cost saving, and improve public health outcomes. The key words for what we're looking for is a sustainable personal protection, eco-friendly personal protection equipment, PPE, pathogen filtration solution, airborne transmission control, pathogen transmission control, and bacterial infection prevention. What are the required functionalities we expect from the solution provided is that it should effectively filter airborne particles, including pathogens, to reduce the risk of inhalation and transmission. The alternative should meet necessary regularity and safety standards for personal protection equipment to ensure its effectiveness. It should prioritize the occupational health by being free from harmful chemicals. It should be made in a way that is minimal or negative impact on the environment. It should also prioritize the comfort to minimize fatigue and discomfort during the extended use. It should be designed for multiple uses, allowing it to be washed, sanitized, replaced, and needed, reducing waste generation. It should include comprehensive education and training program to ensure that the usage of it meets its qualifications. This is the proper usage, maintenance, and disposal of this alternative to promote sustainable practices and help prevent unnecessary waste generation. And the final one is that there should be transparency in the supply chain with clear documentation of sourcing, production practices, and disposable methods, allowing for accountability and informed consumer choices. So this is my last slide, and there will be questions open at the end, and I will leave the floor for my colleagues. Thank you very much.
Thank you very much, Ali, for the presentation of the details of the use case and what we are seeking. Now, Carsten Lenke will showcase our findings in the market analysis.
Yes, Carlos, you're right. Wait a minute. I just share my screen together. There we go. And then I go in presentation mode. So should see presentation mode, hopefully. One reply from the audience, please. Yes, I hope so. So, Carsten Lemke, my name, working for the Center for Innovation and Technology in North Rhine-Westphalia. Here we have the European and Innovation Agency of North Rhine-Westphalia. And we have the pleasure to work mainly in work package for market analysis, as Carlos said. And I'm going to give you a presentation about the topic Ali already addressed, and giving you our market analysis findings. So, well, I can skip the introduction, just referring that the market analysis areas of investigation really started in the summer of 2023. And you will see later on that we, to some point, extended the presentation and the topics Ali already presented in regard to the requirements, the functionalities. We did it through research on the web, in research databases. We did many interviews with experts, with stakeholders from industry, from research. We looked at what is on the market with trade fairs, and so on. So I think the European dimension of this topic, which was presented here by the Working Group of Sustainability, is quite clear. It came, everybody got in contact with this during the coronavirus pandemic. This has challenged the European society in many ways, and millions of disposable face masks have been procured, used alongside disposable gloves and gowns to protect us as the population. And when you look at this topic and reading the papers, you could also find that the European Environment Agency, IIA, referred to this in a briefing published in 2021, and they analyzed the impact of the pandemic on the use of certain single-use plastic products, which cause greenhouse gas and other emissions and thus pollute the environment. So it's quite clear that we should address this topic and look for good and innovative solution. So in this OMC, we therefore looked at the one side at the question of the reusability of disposable face masks, and secondly, examined the question of whether hospitals in certain functional areas can be upgraded or equipped with a mobile air purification system in such a way that the air is no longer polluted by pathogenic germs, viruses, and bacteria. So we widened to some extent the starting point and the starting ideas of the working group of sustainability, looking at the pollution of the face caused by the face masks. So when you look at this topic, the surgical face mask, SFM, used in hospitals and care facility typically consist of multiple layers of materials that perform different functions. So you have an outer layer, which is made of a water repellent material, mostly polypropylene. It's used to prevent the penetration of liquids such as splashes and droplets. Then you have the filter material in the middle layer, fine filter material that can filter particles, aerosols, usually made of polypropylene, polyester, other synthetic materials. And then you have the inner layer, often and best a soft material, non-woven fabrics, which are comfortable to wear and protect the skins from irritation. So this is the structure of a normal surgical face mask, and we concentrated during our research mainly on these aspects. As you know, there are other face masks on the market. And then we looked on the one hand side, as you see now in this and the coming slides, what are the reachers aiming at? Where are approaches who could help later on, as Beatriz Gomez showed, ending up in further research in a PCP or a PPI? So the approach is firstly in the use of the sustainability materials. So using organic cotton, bamboo fibers, hemp fibers, recycled plastics as well to make a face mask. And these materials can be or should be biodegradable or come from renewable resources, which would lead to an improvement of the environmental friendliness and environmental factor and CO2 footprint. You can also think of, and we found researchers doing development of washable filters or filters with special properties. So washable materials, also special fabrics, microfibers that could be used multiple times, not only once, reducing the need for disposable filters. So to prolong the usability of a normally single-used and then multiple-used face mask. But you have many targets to address. You have the wearability as a question. You have the filtration efficiency, which should be as high as in the single-use face mask. You have the aspect of disinfection, and as well, quite clear, you have the reusability, which is addressed here. So quite many targets to address. And yeah, the researchers approached these challenges also in the integration of antimicrobial properties. Special treated fabrics by adding antimicrobial additives during the manufacturing processes. So you have, for example, bioactive nanofiber properties, which where you have stimulating nanomaterials which can be used to create a non-disposable and extremely comfortable respiratory masks with light-controlled self-disinfection capability. So many different addresses here. The picture on the right is taken from the Institute for Basic Technological Research from the Polish Academy of Science in Warsaw. So very interesting research approaches, which to our opinion could end up in new face masks having these properties and having addressing the targets which Ali Faki addressed 1 minute ago. So, and when you look at the next level, as I just said, looking at the air quality in a hospital or in a home for elderly people, you can also say, oh, it's an essential part of modern air hygiene practices that improving air quality is a target. It's important for occupational safety requirements in medical facilities, and air purification creates a healthier and more comfortable environment for patients, for staff, for visitors. So the requirements for air quality in healthcare facilities, they vary from department to department, and very often also from room to room. So in some areas, you have highly effective filtration of airborne microorganisms, bacteria, viruses, fungal spores. They are required to protect patients, staff, and visitors in operating rooms, in intensive care units, in tuberculosis isolation rooms. While in other areas, you have gaseous pollutants, chemicals, and others need to be filtered to create a safer and more pleasant working environment. Also in laboratories, in autopsy rooms, dental offices, pharmacies, etc. So this is the background we are dealing here when we are looking at the air quality in the healthcare systems. So what are we talking about when you look at the airborne pathogens? So just here at this picture, I've taken from a very good brochure, Protection Against Airborne Viruses from Camphor, a big player on the market. There you can see from very small diameters in microns, 0.13, 0.15 is coronavirus. Big coming to the bigger pathogens, tuberculosis 0.86 and strep is 0.90. So it's getting bigger and bigger. So the control of airborne microorganisms, they are setting as a number of diseases and infections can be transmitted by airborne pathogens. So, and we looked at the nosocomial infections, which are particularly problematic. They can have serious consequences in the form of increased patient mortality, morbidity, and longer hospital stays. So also you have a group of where you have the immunocompromised patients, which are particularly at risk because their immune systems are more susceptible to infectious pathogens, such as Aspergillus. So coming to the engineering solutions, we found many different technologies. We found key technologies which I just present you briefly. You will have the possibility later on to look it up also in the market analysis report in this presentation, and we are looking for your suggestions and hope that you participate in that. So you have air purification systems with what you know, the HEPA filters, the high efficiency particulate air filters. You have ultraviolet C light systems. We have plasma air purifiers. We have ionizers, and these systems are used either directly in central ventilation systems or as independent mobile standalone versions. So you also can think about surface coatings, where you use specific coatings on surfaces in hospitals, care facilities. And examples of this are antimicrobial coatings, which can continuously disinfect surfaces and reduce the transmission of germs. At the right-hand side, you see a 5-stage purification step with different filter systems, activated carbon, medical-grade HEPA filters, polypropylene pre-filters, and more on, so that in total you have a very good purification system here. What we found on the market is that UV disinfection devices are used very broadly. When you look where the optical radiation lies, it's roughly between 100 and 300 nanometers in the wavelength. So DNA and RNA are destroyed by UVC radiation. So, and this is the effect which is used here to kill germs on surfaces and also in the air. These devices can be used in operating and are used in operating rooms, in intensive care units, and in other sensitive areas to ensure thorough disinfection. We found many good and interesting companies who are dealing with the topic of UV disinfection. German company which has developed a disinfection system together with virologists at the and physicists from the Charité in Berlin, the famous hospital there. Further companies from Germany, Peschel, and from England and Australia, Gamma Healthcare Limited here. And these systems are also used, as you can see it on the right-hand side, in cleaning robots, where you have the lamps which are used in mobile devices, and you have the UVC disinfection and use these robots. Denmark has a very interesting company, UVD Robots. They use these UVC lamps to sterilize the air and clean them for airborne pathogens. And this company is a subsidiary of Blue Ocean Robotics, and it arises from the cooperation between the company and the Danish hospitals. So the hospitals themselves were integrated and have put their knowledge in the development of such a system. Yeah, looking to also what we found, the plasma air purification systems integrated also in the HVIC infrastructure. We have proprietary bio-HEPA filters incorporated in a multi-stage air contamination reactor. And here you use electron beams and plasma to break and to have when you're looking at the scanning electron microscope, you see before and after the pictures of the pathogens which are destroyed when using plasma air as a purification system. But not system is suitable for specific, or each purification technique has its advantages and disadvantages when you look at the pollutants. I put it like this. And looking at this table, which you also can find in the analysis there, that you see that you have high efficiencies with volatile organic contaminants, with the adsorption, with photocatalysis, purification technologies, and plasma, and extremely high with microorganisms, bacteria, and viruses with UV radiation. So these are the technologies we found on the market. There was a big review study on these different systems and filter technologies done by Chinese scientists in 2017. Sorry. So to conclude, do we see potential gaps? Do we see the possibility for R&D? There is need for innovation in regard to the reusability of disposable face masks, we would say. So we have shown that there are research groups dealing with that, but we have no solution on the market right now. The solutions available on the market are generally suitable for protecting the wearer of the mask from viruses, and this has been proven by studies. However, there is still room for improvement in regard to costs calculated per mask. So disposable masks are still many times cheaper than the mask that can be used several times. So this is quite a challenge for the market companies there. And hospitals and purchasers in healthcare facilities, they will certainly only procure sustainable face masks when they are offered at competitive prices, that is for sure. So tendering of a PPI project can be a suitable means to establish the innovation in the market better than before. So yeah, thanks for your attention at this point, and looking forward to your questions in the question and answer session later on. Thanks.
Thank you very much, Carsten. Just before giving the floor to Egli, just let me say that this is a perfect. This presentation is a perfect example of why the supermarket consultation exercise is necessary within the procurement of innovation process. Initially, there might seem that this is the scope of our challenges is narrow, but with this presentation, we have seen that there is a very broad numbers of topics that we have to take into consideration, and this is why it is so necessary that we get valuable feedback from the real experts on this matter, on how that will allow us to fine-tune the scope of a potential tender. So once again, as my colleague said, these are our findings, but the main objectives of this all is to improve these findings with the feedbacks of the experts, so we can really shape feasible and interesting tenders and contracts for the development of solutions. And now, Egli Rokia, please, the floor is yours to present the state-of-the-art findings, our state-of-the-art findings.
Thank you very much, and thank you, Carsten, for your nice presentation. Can you share my screen in full mode?
Yes.
We can see.
Okay, thank you, perfect. My name is Egli Rokai. I work for Corporate Procurement Services, and we are part of a Procure for Health consortium. And I'm going to present you the state-of-the-art analysis that, along with the market analysis that my colleagues from Zenit just presented, allow us to have a full picture of the market regarding our use case. First of all, what is the state-of-the-art analysis? The state-of-the-art analysis, which is the priority analysis and IAPR sets, identifies products, services, standards, patterns, and publication to define the TRL of the relevant solutions. And this is the TRL pathway that my colleague Beatriz previously explained, so I'm not going to further dive into it. As for what is the IPR sets, the IPR sets finds out which of the information available in the public domain, like existing products, ongoing products, development, and published ideas, is already protected by IPRs by searching for registered intellectual property held on national or international databases. And as for the methodology that we followed in order to conduct our state-of-the-art analysis, first of all, based on the keywords identified to deliver, we try to deliver the existing patent standards. We interact with partners, in this case, Zenit and the rest of the partners, to discuss the technologies and the outcome of market analysis in more details. The results of the standards and patents derived from a combination of sources, such as using the Analytics Intelligence Platform, utilizing the national standard organizations such as ISO/CEN and DESIS. An initial output of the market analysis provided by Zenit was used as a reference point, and throughout the research, the list of keywords was further refined to weed out extremely precise queries. And finally, the search was limited to the last 10 years in order to guarantee that the material included was up to date and focused on modern research and technology. So for the patents, we use the following keywords: sustainable personal protection, eco-friendly personal protection equipment, pathogen filtration solution, airborne transmission control, face mask, sustainable, eco-friendly, transmission control, pathogen-free, pathogen filtration, hospital room, PPE, pathogen, and airborne, among others. And as for the results that we get, the analysis revealed research on the following aspects. We found research that focuses on developing face masks and PPE that are eco-friendly, biodegradable, and made from sustainable materials. Also, we found that the research emphasizes the importance of creating face masks that effectively protect against various respiratory hazards, including dust, fumes, vapors, and viruses. The research also investigates methods to incorporate materials with antiviral and antibacterial properties into face masks, and introduces various manufacturing techniques that are explored to produce the mask efficiently and hygienically. The research also emphasizes the importance of making eco-friendly face masks as accessible and affordable to the community. This involves using low-cost materials and manufacturing processes that can be scaled up to mass production. So this mostly addresses the social aspect of our use case. Also, there are efforts focusing on reducing mask disposal environmental impact by using biodegradable, sustainable, and recycled materials in mass production and exploring recycling methods to address concern about plastic waste. And there is an increased focus on breathability, wearability, comfort, and portability with consideration to prolong and everyday wear in the design of the reusable face mask. And also there is a rethinking of the physical design by eliminating seams and degrading structural elements to enhance functionality and overall comfort, and incorporation of additional features such as air purification techniques that Carsten truly explained. And there is also development of PPE with versatile features such as removable front sections for added functionality, absorption of secretion of integration of communication devices, and these aspects aim to enhance usability and adaptability in various scenarios. And there is also investigation into personalized protection against airborne virus through the design of personal air sterilizers, which are incorporated into headgears. And finally, several innovations prioritize sustainability and cost effectiveness by developing masks that are reusable and sterilizable. And this approach aims to address the issue of single-use waste associated with disposable masks, while also ensuring the safety and efficacy of masks used through methods such as ultraviolet and germical irradiation. So we can see that looking at the patents, there are patents out there that address most of the functionalities and are used for what we want. And we also discover some relevant tools used for our use case, such as electrospinning equipment, sterilization equipment, chemical treatment apparatus, ionization equipment, 3D modeling software for mask design, data analysis software for processing sensor data and mask, smart mask devices, filtration systems, among others. And as of technologies used, we see that we have nanotechnology, automated manufacturing technology, antimicrobial technology, UFC light, UV resistant technology, filtration efficiency, enhancement technology, wireless communication technology, among others. As for a general, basically, introduction and to our findings, we identified over 3,700 patents to all three aspects of our challenge. And when I'm saying all three aspects, is that we started with our use case being about alternatives to single-use face masks. We incorporated the social and economic elements, that is the final version of the use case that we have now, and also the purification devices. Out of these 3,700 patents, we found that 140 are relevant to our use case. This number resulted from an increase in the numbers of patent applications in the last 3 years in several domains, such as medical technology. And we can also see by the patent activity that from 2020 onwards, we have a huge increase, which that chronologically coincides with the start of the pandemic and the huge demand of face masks and other protective materials. And overall, the patents find application in several industry domains and fields such as microbiology, chemistry, and pharmaceuticals. And on the right, you can see a table of the top 10 patent applicants, where we can see that the 26 of the patents were granted to the first 10 significant applicants, which could suggest that this domain, despite this wide implication and the risk that is possessed to civilian, and the room for innovation could still potentially be high. The next, we can see the industry trend over the last 3 years, where we can notice that there is a spike in patent activity from 2020 onwards, as we mentioned. And here we can see the geographical distribution of the patents. We can see that the top patent applicants countries are United States, which has a significant lead, then countries like China, Japan, India, Canada, and we can see that Europe is significantly lagging behind here, which could mean that there is a potential high room for innovation in the domain. And let's move to the standards. For our standards research, we use the same keywords as the ones we used for conducting the patent research. We found only 8 relevant standards, and the majority of them are about PP general and not specific for our use case. And this is a standard example. We have the title on the left, we have the document ID, we have the publication date, and we have the abstract, which allow us to identify the relevance to our challenge. And that was it from my side. Thank you very much, and we'll be glad to address any questions that you have.
Okay, thank you very much, Egli. Now we have time. Now, this has been all the presentations from our side, all the work that we have been conducted, definition of the use case, the market analysis, the state-of-the-art analysis. These are our findings and our challenge. Now we have some room for questions you may have. Please, you can either write them in the chat or even raise your hand.
Actually, no question in the chat until now.
Well, we have Ingo.
Yeah.
Sorry, Ingo.
Yes, good morning, everyone. I was thrown into this audience here from Alexis from the NHS in Yorkshire. I don't know if she's participating, so I'm not I've not been aware of the group before. Sorry for that, but I can introduce myself shortly. I'm from Denmark. We have actually developed a mask which is completely sustainable in the terms of recyclability in a closed loop system. So we use standard materials, and we have a regain of materials about 96% of the mask weight. We can get back, and we can even, since it is a closed loop, we can recycle the mask and get the material to become new masks. So since it is polypropylene, we can do this a number of times, and then we have to make a chemical recycling afterwards, but it's all in a closed loop system. And we represent also ourselves in the EU standard organization CEN TC 205 in the working group 15 about the 14683 standard for the type 2 mask. And we have managed to also get some input for the, I can see Alexis is here. Hi. We have managed to get some input for the recyclability and material point of view into the standard. and hopefully this will be a part of the standard in the near coming future. So what I would like to point out when I see the presentations, I came a bit late into the meeting, sorry for that. But my point of view is that the biodegradability is a very, very nice thought, but indeed it will not help for a lot of things, which is also standard based. So we really need to have the security point of view into as well into the picture, and that's what we can see is a big challenge for all concepts what we are looking for right now. And therefore we took the way as a manufacturer, we took the way to keep the track on what we know all together and concentrate on the material point of view. And indeed, when we release CO2 into the atmosphere, this is a problem. But if we keep the carbon molecules safe and close to us and not release them in the atmosphere, we do not have any problem. As you can see, even landfill will not give us any problem in the atmosphere. So I'm not, of course, advocating for having landfills at all, but having materials in a loop. So that's what I would like to tell you. Thank you very much.
Thank you very much for the information that we have to consider. I think we have one hand raised also from Alexis.
Morning, everyone. So as Ingo was saying, we're writing some standards within CEN at the moment. So the working group 17 that Ingo was part of, but we're also writing is the respiratory infection prevention devices standard. It's 3 years in, and we've probably got another year or so to go, but it will incorporate circular economy, carbon footprinting, water footprinting, and a full assessment of everything that is required for all face masks. And that's face masks for the fire industry, for the health industry, so across the board. So it is something that is coming, that it will be required, and there is a working group to look at PPE across the board. So all of these will be requirements to be looking at footprinting of everything. So you'll be able to do an environmental assessment of a product and do a direct comparison. So that is in the pipeline, and if everybody starts to look at that now, we can then say this is the way it goes, and that will also include single-use items as well.
Karsten, please.
Yes, thanks. Yes, thanks, Alexis and Ingo, for your additions. And I can add at this point that we found an interesting study. I didn't mention it and did not put it here on the slides. Done by the NHS in the UK, dealing with this topic of reusability and doing the reusability of face masks, dealing with and it was a study during the pandemic. I think you will know this, Alexis. So we came upon this and the results, but it was a little hard for us to really go a little deeper, which sort of systems, as Ingo just described, dealing with the polypropylene, looking at the closed loop system. So this was also our hope in regard to this topic of reusable face masks, not the other part which I presented later on. Yeah. So please add your experiences in the questionnaire.
Well, what I'm getting from this conversation is that, and please correct me if I'm wrong, Ingo and Alexis, is that these are standards that you are working on that are coming for sure, and that we obviously will have to take that into consideration when designing or preparing the requirements that we'll have to include in our future tender processes. So yes, please, we will have to have that information and that detailed standards that they'll have to fulfill. Thank you. Okay. We have some other question in the chat. First one is obviously the objectives. Do you already have a timeline for the PCP? I don't know, Beatriz, maybe I can answer that. Okay, as I said, this is a Procure for Health activity. The scope of our community and the scope of our project is, let's say, reach to this point, and with the results of the open market consultation, decide what is the best procurement of innovation approach. As Beatriz presented, we have several options: pre-commercial procurement, procurement of innovation technologies, even innovation partnerships. It depends on the level of development of the market to provide a solution. But obviously, what we are looking for from now on is for the resources to launch common joint tenders from the members of Procure for Health. We are already working on that. There are already opportunities at the European level. So, I mean, we cannot ensure nothing 100% yet because we're working on the obtention of those resources that allow us to carry on. But hopefully, we have news from us during 2024 at some point, or early 2025 for the process. Yeah, Carsten?
Yeah, maybe Carlos, if to add one idea we also aiming at in our Procure for Health project is that we write an action plan dealing with all the results of the working groups, also of the working group of sustainability here, and then we can address all the topics, all the gaps we found during our market analysis, and we can address this, and we'll address this action plan paper also to the to EC, and hoping that this will result in further PCP PPI actions and calls. Yes.
Of course. As I presented at the beginning, this is a process of innovation journey, and this is one of the stages. And obviously, we plan on going on and carrying on with these activities. Okay, there is some. Okay. I cannot see any further questions in the chat. Well, there is one more question. Are manufacturers involved in the sustainability working group? No. As I said, I mean, I presented at the beginning, we are a community of health and care services providers, mostly public, not all of them. But when we're talking here at the discussion in the working groups is to define, assess, evaluate, and prioritize what are the needs of, in many cases, public health and health services providers. So we're talking about how to use public resources. So at the initial conversation, it has to be among us. But this is the point, and this is obviously the procurement of innovation process. This is a co-creation process. It needs to be we need to work very closely. We need to really let the market players to understand what are our needs, and it's something that it is a process. So this is why this is the moment, this is the first contact we're making with the market players with the objective of keep it permanently from now on. Okay. So if there is no further comments, Okay, some more extra information about the standards. That's very useful and we will take into account. I don't know if there is any final remarks that any of my colleagues would like to make before closing the session. Well, there is another question that just came in. Can I ask what is being done at the health and care setting to ensure there are decontamination processes in place for reusable masks? This is a question that I'm not able to answer. Maybe some of my colleagues can. Ingo?
Yeah, what what we did in the closed loop system was, of course, to have very much precaution on the effect of the Corona period, and we actually invented a bin which was included a UVC lamp, a very strong one, inside the bin, so we could dispose the masks in the hospital, in the operation theater, whatever. We could place the masks inside this box, and during the application of the mask into a slide, we could actually decontaminate most of the masks virus or potential virus content. But after we made with the Danish Technological University a certain study, we found out that the effect of this irradiation was not very good. So the mask would not be decontaminated properly. So after the pandemic, it turned out that we just received the masks as they are in the closed bag, and then we had on the plant where we do the recycling, we stored the masks in a while, and then we had precautions, PPEs on to in the recycle process to take the first steps. It's notable to say that the material, when we recycle, then the material is heated up to 220 degrees Celsius, and in an extruder, and afterwards or in the same time at 6 bars, and this is pretty much more than a standard autoclaving process. So that means that we kill everything what is inside the masks at that point. So in this stage, there's of course in the logistic point of view, in the closed loop system, there's a challenge which of course every system has to look into, depending how they do in each healthcare institution.
Thank you. I don't know if this answers your initial question, so give you an idea, Rebecca. Okay, if there is no further comments at this point, I don't know, maybe, and now I'm looking to you, Beatriz, would you like to do a final remark about the relevance of the feedback for us and where they can find all the information once again? And what is the deadline, at least the initial deadline we have in order to gather feedback that allow us to at the end be able to design interesting contracts for us and also appealing contracts for the market players to work with us in these developments. Beatriz, any final remarks?
Yes, of course, Carlos. Thank you for this. Yes, I copied in the chat the link to the questionnaire, also the link to the OMC document, so you can just click and go to it. And you have until the 20th of May to submit your contributions to the questionnaire. And actually, what Carlos said, the idea of this project is to prepare the future PCP. So at this point, your contributions will be essential in order to define the timeline, as it was discussed in the chat, the budget considerations, any other requirements concerning capabilities, technical capabilities or financial capabilities, in order to ensure that if in the future we launch this tender, it will adapt to the market capabilities and to the market situation. So please, again, I really encourage you to participate and provide all your feedback, because it's really, really essential for us. So that was my final remark. And of course, thank you very much for attending to this webinar today. And Carlos, I come back to you.
Oh, well, that's great. Yeah, nothing else to add to that final remark. Once again, thank you everyone for your time, for your insights. Keep tuned to what we're doing in Procure for Health, and please enrich our findings with your express feedback. Thank you very much. Bye.
Thank you. Have a nice day. Bye.
Bye.
Bye, everyone.
Thank you. Goodbye.